Hi, my name's Alina and I'm going to teach you guys a little bit about Meniere disease. So basically what is it? It's a disorder of your middle ear, and so the etiology behind it is unknown, but in about 90% of cases it's unilateral, so it only happens in one ear, but it can be bilateral as well. So basically what happens is endolymph builds up in your membranous labyrinth, which produces pressure, so as you can see here, and that disrupts your vestibular and hearing functions. So we'll talk about that in a little bit. It's considered chronic, but there are treatments which can minimize the impact that it has long-term in your life, and it is more common in 40 to 50-year-olds, but anyone can get it, even children. So as far as causes go, they're not really well understood, but people think that they're likely caused by multiple factors combined. So your inner ear pretty much goes through fluid changes or imbalances, and these tend to have some connection with various factors such as trauma, infection, allergies, anxiety or stress, if you aren't draining your fluids properly, which could possibly be from an abnormality in your anatomy. You could have an immune response that's not functioning properly, or a genetic predisposition, or you could even have migraines. So this is a picture of what it would look like if you had Meniere's disease. So signs and symptoms, usually there's a sudden onset of this, and the episodes occur and then they'll subside. So basically each episode may last about 20 minutes to 4 hours. And this tends to be a recurring thing, so you'll experience profound vertigo, which basically vertigo is a sensation of a spinning motion, so as this guy is experiencing right here. You might have severe nausea and vomiting, and this is also associated with deafness, and as you can see in this picture here, but it does you tend to recover between attacks as well. And then you also will experience tinnitus, which is called a ringing in the ears. And sometimes you will feel a fullness or pressure in your ear as well. There tends to be a triad right here of basically 3 symptoms that are common in Meniere's disease. So that's vertigo, tinnitus, and deafness. As you see here, vertigo, tinnitus, and deafness. And then the frequency and duration of these symptoms does vary, but the diagnosis, in order to diagnose this, you have to have at least 2 spontaneous episodes of vertigo that are lasting at least 20 minutes each. So to test for vertigo, we can do clinical testing and hearing assessments, as this guy is doing over here. We can also do balance testing. So there's, as you can see, these are some different ones. I'm not going to try to pronounce them, but basically this one right here, it assesses your eye movement, and it basically uses warm or cool water or air put into your ear, and your eyes will move in response. This assesses your eye movement by rotating this chair and seeing which way your eyes move. The vestibular evoked myogenic potentials is a way to measure the function of the sensors to detect acceleration movement, and then posteriography pretty much reveals which part of your balance system is being relied on most and therefore causing impairments. So you can also do a CT or an MRI, or you can do an auditory brainstem response audiometry, which is a picture of what this girl is doing right here, and that would rule out any tumors. So as far as treatment goes, there's no cure, but it does depend on your symptoms. So you can either go for a low-salt diet, you can medically manage it based on different medications such as motion sickness, anti-nausea, or long-term. You can also do middle ear injections as well, such as gentamicin and steroids. You can do diuretics, or possibly a minimally invasive surgical management, which would include things like endolymphatic sac procedures, labyrinthectomy, and you could also remove the vestibular nerve, as you see here. This has succeeded in 95% of cases, which means that, well, in 95% of cases, it relieves the patient of the symptoms of vertigo and deafness that they're experiencing, and non-invasive procedures are also an option, such as rehab, a hearing aid, or a Meniere device. You can also make some lifestyle changes, which would be really good to do. So you can make sure that you sit and lie down immediately when you get dizzy. You can rest during and after you experience attacks. Be aware that there is a possibility that you may lose your balance. Also, don't tend to drive a car or operate heavy machinery. Make sure that you eat regularly and often, and you limit your salt intake, as well as avoiding any of those MSGs. Also, it's smart to avoid caffeine and to obviously stop smoking. It's helpful to manage your stress and anxiety, and you can avoid allergens as well as prevent any migraines. So these are my references, and thank you. I hope you learned a little bit about Meniere's disease.